Obesity is a chronic medical condition characterized by excess body fat that can negatively impact health. It is often defined by a body mass index, BMI, of 30 or higher. Obesity can lead to various health complications, including heart disease, diabetes, and certain cancers. Here's a comprehensive overview of patient information related to obesity. Etiology, causes of obesity. Obesity can result from a combination of factors, including genetic factors. Genetics play a significant role in determining how the body stores fat and how the metabolism works. Inherited traits can predispose individuals to obesity. Environmental factors. Easy access to high-calorie foods, sedentary lifestyles, and activity can contribute to weight gain. Urbanization and marketing of unhealthy foods are also contributing factors. Behavioral factors. Poor eating habits, overeating, emotional eating, and lack of physical activity are key contributors. Psychological issues such as stress, depression, and anxiety can also lead to overeating. Metabolic factors. Some individuals may have slower metabolisms or hormonal imbalances, e.g. thyroid disorders, that make it easier to gain weight. Medical conditions. Certain conditions such as hypothyroidism, polycystic ovary syndrome, PCOS, sleep apnea, and insulin resistance can contribute to obesity. Medications. Some medications, including antidepressants, corticosteroids, and certain diabetes medications, may cause weight gain as a side effect. Body mass index, BMI, the most common method for diagnosing obesity. It is calculated using the formula BMI equals weight times height m2. Normal weight, BMI 18.5 to 24.9. Overweight, 25 to 29.9. Obesity, BMI 30 or higher. Waist circumference measures abdominal fat, with higher risks associated with a waist circumference over 40 inches for men and 35 inches for women. Waist to hip ratio, WHR. A higher WHR can indicate a higher risk of heart disease. A ratio above 0.9 for men and 0.85 for women is considered high. Physical examination. A thorough exam helps identify signs of obesity-related conditions such as joint problems, high blood pressure, and skin conditions. Obesity increases the risk for various chronic diseases, including cardiovascular disease. Obesity is a major risk factor for heart disease, high blood pressure, stroke, and high cholesterol. Type 2 diabetes. Insulin resistance caused by excess fat can lead to high blood sugar levels, increasing the risk of developing diabetes. Sleep apnea. Obesity increases the likelihood of obstructive sleep apnea, which causes breathing interruptions during sleep. Joint problems. Excess weight puts pressure on joints, particularly the knees and hips, leading to osteoarthritis. Cancer. Obesity is associated with an increased risk of various cancers, including breast, colorectal, and endometrial cancer. Fatty liver disease. Non-alcoholic fatty liver disease, NAFLD, is more common in individuals with obesity and can lead to liver damage. Mental health disorders. Obesity is linked to depression, anxiety, and low self-esteem, as well as poor body image. 4. Management and treatment. Treatment for obesity involves a combination of lifestyle changes, medical interventions, and in some cases, surgery. A. Lifestyle modifications. Dietary changes. A balanced, calorie-controlled diet rich in fruits, vegetables, whole grains, and lean proteins. Reducing processed foods, sugary drinks, and high-fat foods is essential. Physical activity. Regular physical activity is recommended, aiming for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity per week. Strength training exercises are also beneficial. Behavioral therapy. Cognitive behavioral therapy, CBT, or counseling can help address emotional eating, improve self-control, and manage stress-related eating. B. Medical treatment. Medications. Some weight loss medications can be prescribed to help control appetite or increase satiety, fullness, such as orlistat, Ali, Xenical, reduces the absorption of fat. Phentermine topiramate, Qsymia, reduces appetite. Liraglutide Saxenda, a medication that decreases appetite and increases feelings of fullness. Naltrexone bupropion targets areas of the brain involved in hunger and cravings. Medications are typically used in combination with diet and exercise and are often prescribed for individuals with a BMI over 30 or over 27 with obesity-related health conditions. C. Surgical treatment. In cases of severe obesity, bariatric surgery may be considered. Types of surgery include gastric bypass. The stomach is made smaller and the small intestine is rerouted to reduce the amount of food that can be eaten and absorbed. Gastric sleeve gastrectomy, removes part of the stomach to reduce its size. Adjustable gastric band. A band is placed around the stomach to limit the amount of food that can be consumed. Biliopancreatic diversion, a more complex procedure that reduces the size of the stomach and bypasses part of the intestines. Bariatric surgery is typically recommended for patients with a BMI of 40 or higher, or a BMI of 35 or higher with obesity-related health conditions. Regular follow-up with healthcare providers is essential for managing obesity. This includes weight monitoring, tracking progress to ensure weight loss is steady and sustainable, health screenings, regular checks for diabetes, heart disease, and other obesity-related conditions, nutritional counseling, continued education on healthy eating habits, psychological support. Regular counseling may be necessary to address any psychological issues affecting weight management. Stigma and discrimination. People with obesity often face societal stigma, which can impact their mental health, relationships, and self-esteem. Body image and mental health. Individuals may struggle with negative body image, leading to anxiety, depression, and disordered eating behaviors. Healthy eating habits. Encouraging a balanced diet with appropriate portion sizes is crucial in preventing obesity. Regular physical activity. Ensuring regular physical activity is part of a healthy lifestyle. Early intervention. Identifying and addressing weight gain early can help prevent obesity. Education. Public health campaigns promoting healthy lifestyles and weight management can help reduce the prevalence of obesity. Effective management of obesity can significantly reduce the risk of developing related health conditions and improve quality of life. Individuals who successfully lose weight often experience improvements in mobility, mental health, and overall well-being. Ongoing lifestyle changes are essential for maintaining weight loss and preventing obesity-related complications. Obesity is a complex, multifactorial condition that requires a comprehensive approach involving lifestyle changes, medical management, and in some cases, surgical interventions. Early detection and intervention are key to improving outcomes and preventing long-term health complications.